If I can make this work. There we go. I got to tell you a little bit about how I got started. I was a working cowboy for many years, and I got dehydrated a lot. The clouds, of course, are coming in, but the rain's not coming down. It's just out there, and the clouds are there. I've got a working horse. It's like that little horse is. Also, we work along with the areas of water that are just kind of like always. Have you ever heard that song about cool water and how well you can be dry and all? And so I did get into water just from dehydration. And of course, this is where I got started, working cattle, seeing that the cattle were also dry, like. Stan said I had to be a little bit short on the singing, so I better just get onto it here. But seriously, I'm a part of the Institute of Health Management and Mass Destruction Defense. That's a lot to do with disaster, and I am pleased to report that the Kangen Water Unit is actually published in two unit articles related to disaster management when we're going to need water, and it's very powerful. And I'm with the College of Public Health, the University of Georgia. And I'm just kind of on the fringe of it, though, because most of spend my time as chief of surgery there in critical care, and that's in Chattanooga, Tennessee. And then I'm with them as a medical director for hyperbaric oxygen here in Florida. And then I'm a captain with fire safety officer with Oconee County Fire. And so I kind of play all these hats. And do I get dehydrated sometimes? And I'm sure that all you do too. And I just bless you for getting into the water, which I got into it kind of secondarily, as you guys have all been working with it for a while. And I, of course, have to give a lot of glory to God. We talk about spirituality. We got to say that. Just think about our universe, and just looking at a cloud. A cloud weighs over 220 billion pounds, 1 billion kilograms, just one cloud that's cumulus. And our oceans, of course, 71% of our Earth's surface is water. And 69% of all that water is in ice. And if it melted suddenly, all of it, just think, we'd be underwater. The entire Earth would be underwater 2.7 kilograms higher than the entire surface of all the Earth. Isn't it amazing, the creation and the water? So, it all started, of course, with Genesis, with let there be light, and the first day. And guess what? That light is all of the electromagnetic spectrum. That's everything, not just visible light. All the way down to when animals were made, they were made before us. And of course, then we have man at sixth day. And of course, then the good Lord had his rest. Guess what? This is important to remember the rest, and I just still don't get enough of it yet. I know, and a lot of you don't either. Many investigations have been done with water, and water makes up, and I crossed that out, we used to say 65 to 85% of our body is associated with water. When Gerald Pollack and I were getting together and him talking about it, and I just realized, and he realized this, he's a water scientist, he said, no, Tim, we're like over 90+% water, 95 in muscle, and that's because all of the interactions with all the other molecules are related to water. So that's not, maybe we're not just, in medical, bone and tissues and all forth. And he talks about the fourth phase of water, what Dr. McKnight was talking about earlier, the crystalline water, the hydrogel water. And it's like the light transfers better, and the protons transfer better, 40 times faster, as he mentioned. And the layers are enzymes. It's not a substrate and an enzyme. It's that there's about 10 layers of water between an enzyme and the substrate. Didn't know that. When we go to vet school, med school, and all that, we think about all this stuff about interaction with enzymes and substrates. Well, now we know it's water-related. And if the better the water, the better off we're going to have with transfer. And so the water molecules are important because of the channels that are important for the light. I spend a lot of my time in the operating room. This is at the Regional Institute of Veterinary Emergencies and Referrals, caring for sick animals and injured pets 24/7. That's how I really got involved with the water. I have a dear friend, his name is Dr. Ray Stewart. I don't know if Ray is here, but he's the guy that got me started. He's the chiropractor. He got me going in the water, said, Tim, I think you'll like this water. And then with another friend, another doctor that's a veterinarian, that he got me going. And that was about 3.5 years ago. And you know, pets and owners are just such a bond. And here's a lady bringing in her older dog who is around 15 years old. And she's got degenerative diseases and arthritis. And we're using a little loop right here. That little targeted loop is to help us with pain. And it sends out a signal. But if the patient's dehydrated, then that signal is going to get through, just like with the water transfer of light through water. And so she's happier because her little beagle now is working along with a loop and getting better with the hydration with the 11.5 water that's used for a soak around that leg, and then also the water that she's on is 9.5. Pets, all pets can handle again the 9.5, but you got to go a little slower with them sometimes. Remember, they have a metabolic rate that is at least 7 times faster than ours. And when you send home an owner with the water for their pet, and this is what I've seen so often, the pet starts to act better faster, and they start running around quicker, like this little beagle. Isn't she cute, you know? And then the owner, she says, wow, my beagle is running around like he's old, but now he's running around like he's much younger. That's the first thing I usually hear, almost on a daily basis in the practice where we are, and I see that all the time. And I spend time getting dehydrated as a firefighter. And I mentioned the story to you earlier about several of the firefighter friends that I've had in which they've been really in trouble because they still aren't quite listening to old Doc talk about water yet, but they're getting there. And this is an old slide, and I don't know if it shows up, but that's a bottle of water in my hand, you know. But now it has Kangen water in it. Yeah. And we had a firefighter that was going down, and he was out, and we started an IV on him because he'd been really hyperthermic, and hyperthermic is, is getting super hot. And we had to take all of his gear off of kerosene. He started an IV on him, and then I ran to my truck and got some water, started giving him the water, trickle it in. I told you that story, but I want to tell you it again. It's important because he gets hydrated much faster. And yes, and we spend time in EMS as well. This is a 45-car pileup on I-75. And there were a lot of people that are working as first responders getting dehydrated. And so it's important to try to get everyone. So when you guys go out, talk to your first responders, talk to your firefighters, and your vets, of course. And, of course, everyone that's got a pet. And just remember this when it comes to the cells. The physiology is the same as it's a human cell or an animal cell. Even the animal cell, those moving faster. The metabolic rates are quicker. We have about 10 trillion cells per 10 kilograms of body weight. So most of us here have probably got 70 trillion cells in our body. And 1 million molecular changes occur per cell per second. Think about that. Every cell has 1 million molecular changes that occur every second. And there's this all about then these radicals that are formed when there's a lack of oxygen. And there's chronically a lack of oxygen. We're not as efficient as a machine. And then we have acidosis, where the buildup of acid, like you talk about lactic acid for the, us that are working hard, but at the same time it happens with all of us. We get acidemic. And we get all at least inflammation, toxic and aging. And you've heard this story before about how it's linked to cancer. Pets have, again, a 7 to 10%, 10 times faster metabolic rate. So they get cancer quicker. They actually then respond quicker on the other end. So if you can save their cells, they're a sentinel for human disease. And we see 60 times more cancer in our pets. Let's say one may be malignant tumors like mass than breast cancer. And so that really is an important area that we can help our pets stay better, stay healthier longer, and if we can get them on the water quicker. And again, that means that we have 7 to 10 times more cancer. In most cancers, it's at least 7 to 10 times more cancer. They're closer to the ground, they're smelling the ground, they're taking up all the toxic materials that are in the ground, as well as, of course, the water. And so let's look at just cellular division for a minute with any cell. And we have about, in the body, we have roughly around 25 million, I should say, mitosis, cells division per second. 25 million every second with cellular division. And this is a little slide from the Hughes Institute that looks at crystalline water. And look at that. The water is darker in certain areas around this, and this is the more solid water. And let's see if we can make that work. This is the hydrogel water is all around here, and we're going to like to see if we can make that function with movement of that water. And so I guess we couldn't, but that's one of those things. I was showing cell division. If we can get the cell division that just shows the cell division, you'd see it again. It's so rapid. 25 million that happen every second. And I guess he's trying to move on. I'm looking at the monitor here. He's got that. Let's see if we can make it work. No. He's trying to get it so it divides. There he goes. Now he'll shine it back up here for you. Watch this. I'm going to be quiet. Dividing. 25 million per second. That's how we then are influence our bodies on a second-by-second basis. Pets and water consumption, I have to talk about that. They can smell the chlorine in the water. The chlorine, when you touch it with a little protein in the mouth, it turns to chloroform or a branch of trichloromethane. That causes cancer. That happens with anything that's chlorinated. Leads to dehydration. These pets can smell that. And I've had a blessing to reach out and meet a lot of you over the course of the last 48 hours. And I had one lady, I don't remember her name, but she said, my cat's drinking twice as much water as it used to. And she said, is that okay? I said, absolutely. That meant he was really dehydrated before drinking the tap water. Leads to less blood flow, leads to less oxygenation, leads to chronic cell changes, leads to increase in the reactive oxidant species. More of a scientific name for the reactive oxidant species is certainly the superoxide radicals. And then the scavenging is done, of course, with the water. And that leads to inflammation. And here's a dog that has a ruptured disc. And that disc is up there because it's a dehydrated disc. It's not like a moving disc like it used to. And here's a dog. His name is Samson. That was his CT scan. And he came in obese with abdominal pain. And initially, he didn't arrive, just a pain from the referring vet, but he wasn't quite sure about his back. By the time he got to us, he was paralyzed. The discs rupture into the cord area, and then he is paralyzed in the rear legs. He can't walk. Well, as you can imagine, something else is going to have to be done besides just giving him, electrolyzed reduced water, Kangen water. But in the beginning of his therapy, he starts on the antioxidants we know about. And so here's that CT scan, a little bit bigger up so you can see it a little better. There's the disc. Here's this cord pushed way up. Here's the edema all the way around here. And then what we do with this is just a model to show what we do is take a piece of bone out, and we then give the cord a lot of room to breathe, if you will, and remove the disc material. So here we are, we're doing the surgery, and I always ask, what can I always do to improve my outcome with my patients? Now, when it comes to post-operatively, we want to hydrate them. So as you go talking to veterinarians, make sure you talk about how much, of course, of it is, as this surgeon, board-certified surgeon, has been doing this for, I'm an amateur, I've been doing it for over 30 years as a surgeon now, and I can't tell you enough how important it is for the water first. Yeah, of course, the food's next, the nutrition, and then the pain control, and it leads to electrolyzed reduced water. And here we are going home. We're starting to walk a little better. Notice the owner has that's a styrofoam cup, I'm sorry about that. But and he's getting the machine in the water, and he's taking home the water, and he's taking home, he's happier, and he's getting some gallons of jugs to go home with him, and the dog's happy, and I'm pleased to report he made a full recovery, okay? Made a full recovery. And we also use another tool, it's called hyperbaric oxygen, and we put the patient in the chamber, and it re-oxygenates the cord as well. But it also produces reactive oxygen species, so superoxide radicals we talk about. And here is the electrolyzed reduced water. You have to talk about it as the scientific term is electrolyzed reduced water when you're talking to your vets, because that's what they'll go to PubMed, and they'll look at pubmed.gov. They'll print up electrolyzed reduced water, they'll type it up, and then they'll see essentially what it is. That is, the water is used as a reactive oxygen species scavenger. And here's a couple dogs. Aren't they funny? Right? Now, and we're always economical in veterinary medicine. What's the best thing I can do economically for my patients is put them on the water. And here we are, though, there's two riding together, we call it a ride-along. I'm not sure who's really driving the bus here, but this is the hyperbaric chamber here. All right? So we got a happy owner, and we got certainly a happy surgeon because he's got the water. And guess what? I start to go drink the water right away coming out of that operating room. Okay. We have general guidelines we want to actually bring to you. And that is you start with 8.5, and that's because most animals are somewhat toxic. And some, if you start them right away on 9.5, we see diarrhea. Not all the time, but boy, in somebody's house, you don't want that dog to run around with diarrhea all over it. So it spoils the whole situation. So you go, yeah. And so you always do this, and use glass or ceramic. Actually, metal bowls are probably not the best either, because they take actually electromagnetic radiation. It's not all good radiation, it's microwave. Some of it's microwave radiation. And it goes into the bowl and it acts like a radar dish. So go back to utilizing things that are glass or ceramic. Then change to 9.5, and then go to 9, after you go to 9.5 for 9 a week, then 9.5 for a week. If they stop and they start to feel a little bit like a little diarrhea comes on or something, stay right there and don't move it. Go back to where you were. And those with cancer and severe inflammatory disease, we'll add a little tiny bit of 11.5 in a kilogram basis. We're using like a 1 ounce per 10 kilograms. That's not very much. And of course, if they're using the jugs and taking them home, the water in those jugs, as you know, it's shaking around and they're going to lose their ORP fairly quickly. So it's really important to get them on fresh Kangen water as soon as possible, because it provides that free hydrogen-based electrons. And so you could do some energy testing with that. We don't have time to work into that as well today, but you can imagine that water essentially is a vibration medicine. It's a vibrating structure. And so as you just test for it, you can do that. And so some of us that are doing in the biophysics side of medicine, you can test to see which water to start them on. Here's Samson. He's 11 years old. He had bone cancer. So that's the second Samson. He's got bone cancer. And in April 2012, he started limping. The owner finally got a diagnosis made with a thickened bone in May, and he started drinking the water. They found me, and they started drinking the water June of last year. Does it go back? Let's see. Oh. Okay. And in August 2012, he was a very happy owner because he's now starting to not limp. He's starting to walk around, yet he's got a tumor. And he's so old that he's an older log. He's 11. He's not that old, but at the same time, he's got a very aggressive tumor, and the tumor started to stop growing. You hear that, what I said? Stop growing. And we could tell physically that he was working very well and good, and then around almost, again, a year later or so, he started having lameness. It suddenly got worse. We don't know all the things about science, do we? And he suddenly got worse, and that tumor started growing rapidly. And then another month later, he was euthanized. So he's now with the Lord just a couple weeks ago. And his average sarcoma, the average sarcoma length of time that an animal lives without the leg amputated, and the reason he didn't have one amputated is because he had a lot of arthritis. Oh, but that helped too. He was running around a lot. Oh, and he was happy. He was just, panting and happy and just really, really carrying well. Well, he lasted more than any dog. On chemotherapy, you get 6 months at the most. And he went, well, what's that? Way over a year, almost 15 months. And here's Milton. Milton's lived through 20 years of age with 2 years of chronic kidney disease. And Grace, the owner, she said, I started the kitty on the water, and the kitty's starting to run around like a 10-year-old. She calls me up and says that. Dr. Crow, you won't believe it, but my little cat that you started on the water is running around and jumping up with a couch and doing all those things that he never used to do since he's been 10. Now he's 18. Well, he lived 2 more years. Yeah, 2 more years. Happy years. And so we see these common clinical conditions, and like I said yesterday, they don't have a placebo effect. There's nothing else that will make them work. So it's very, very important that the chronic renal failure, the chronic liver disease, a mammary gland carcinoma, these are tumors, prostatic disease, degenerative joint diseases, asthma, pneumonia, heart disease, autoimmune hemolytic anemia, big disease that has to do with fighting and breaking down the red cells, degenerative disc disease, like we showed with Samson. Some of those animals, when you first early get the diagnosis and you put them on the Kangen water, they don't need to have and rupture their discs. They rehydrate. And then they start feeling a lot better. And then they don't have to come to me. And the common clinical conditions, like we see so many animals that still get hit by a car. And they got bumps and bruises, of course, so they may have something else. Snake bite, and we see burns. The burn patients do very well with the pain. You know how important a burn is for pain? To help take care of the pain, we put 11.5 on the water. And I say from Dr. Horst, my friend Horst, he's talking about also, Horst Felter talks about using 11.5 on the burns as well for humans. And then foreign bodies, we remove them. Dental and ear diseases are common, and bowel disease and eye and conjunctival infections. And it brings me to Maggie. This is Brian Welch's little kitty. Isn't she cute? Even at a couple, 10 days old or so, she's got eyes that are just barely getting open because he was able to use the 2.5 water to get the eyes open. I guess one of his friends found the little kitty alongside the road. And, of course, the nose was all conked up with a lot of pus. And the kitty was, you won't show you the other end because it was even worse looking, but it had maggots all the way through that cat. Very toxic, very toxic. So squirting that 2.5 water up into those maggot holes made it really, those maggots just come out, the infection that's involved. Remember, there's no bacteria, no virus, nothing like that actually withstands 2.5 water. Nothing. So here's Maggie. Isn't she cute with her eyes open and doing well? Brian, thank you for sharing that with us. And of course, we know that true joy and happiness comes when we can really help our little animals like that. And so here's Maggie today, 2 days ago when we took this picture. And you can see who is the happiest. I don't know. I think they're both very, very, very happy, And let's look at what's going on with her at this point. Sorry about that. I guess that picture didn't show up. Well, we'll go on. But Maggie has got some other thing related to potentially an eye situation, in which I just told Brian to go ahead and start soaking the eye area with 11.5 to get the antioxidant available into that tissue, because it could be still left over from a meibomian gland that is stuck, and it's got a little swelling there. So he's going to go for that. We see severe wounds. I mean, I had to show you some bad wound. I'm a surgeon, okay? Sorry. All right, I know it looks ugly. And we see severe wounds. The first thing you do as a pet owner is to, of course, cover that wound. It's bad bacteria. There could be MRSA, methicillin-resistant staph that we get. And we also see severe contamination. Severe infection leads from that contamination. We see shock, dehydration. Can you think of things you can use out of your machine for that? Absolutely, right? Okay, we're going to quote low, the electrolyzed oxidized water, low pH, 2.5, nanoclustered, or essentially it is declustered, and that is gets the water into the tissues to help rehydrate. And we know that infection is related to dehydrated tissues. So you're going to rehydrate the tissues, use something that's going to kill the bacteria, stop the bleeding, put some pressure on it, and then use an acupuncture point of Li11 right here in the arm is very good for animals. Any kind of critical ill crisis situation, Li11 right here, it helps calm them. And then also governor vessel 26 for resuscitation, and that helps there. And then anesthesia, and of course in the surgery that we do, and then of course we're getting prepped up in surgery to do a bad wound case. Because remember, again, electrolyzed oxidized water, the scientific term of what you're using, which is the low pH, the 2.5 water, kills viruses, kills bacteria, kills fungus. It's used for irrigation, so there'll be a severe wound. Isn't that wound better now? Remember that wound? Yes, we had to do a flap and irrigate all out, but that's all we got left, and that was just taken this last week. All right. These wounds just amazingly do so much better. And then we use it also in the dentistry, for oral infections, for the bad burns we talked about. In the burn situation, the burn wound is infected, we use the 2.5. Then follow it with the 11.5. On traumatic wounds, same thing. Again, we do the same thing. Use infected wounds again and follow it again with 11.5. And so head injuries, I have to tell a little bit about that. Hydration plays such a big role in head injuries. Unfortunately, a lot of us veterinarians, we learn to give fluids, it makes the brain a little more swollen. So we need to be able to, of course, do things to help. This is oxygen going into the patient. We're watching his pulse oximetry. That's something we use for oxygen to monitor oxygen levels. And it's really interesting when we start trickling in water on some of these patients, how their oxygen levels, you can measure, and they're going up. It's like blood pressure going down because they've got more flow. You see the oxygenation going up. And then here's what a little dog, his name is Sally, her name is Sally, and she had half of her face almost removed by a machine, a farm machinery, just take off half of her face. But she's the happiest little pup because, again, we use 11.5 after we use the 2.5, and we did that frequently. And she's just the happiest little girl. She just has one part of her nose, but she doesn't know that. She's just the happiest little girl altogether around. And then here's just a wound. A simple little wound can turn into a bad thing. So a little itching, whatever, a little bit of inflammation in the skin. Start with 2.5, apply the 11.5, then go back to 6.5 or to 8.5, somewhere in there, depending on, and then drinking the 9.5, and do that frequently. So here's Franklin. Franklin was itchy all over, and he was in for a knee surgery, but the lady, I noticed he was itching all over. He's just like, what's going on? Well, he was allergic. We find out with biophysics he's allergic to a couple of things like corn and wheat, and we get him off of those. And do you think this lady is very intense about getting the water for her dog? Yeah. And it helped his arthritis as well, and that dog is moving so well. I just saw him last week, and he's doing so good, again. And then she starts drinking the water too. All right, then she gets better. All right? And we get the performance animals that are just so into it, and they're not fighters, but they sure are jumpers. Out here after a frisbee, and out here going after these dog jumped over the docks and so forth. Obesity is a killer for us in animal medicine as well. We see so many animals. 70% of some practices have pets that are overweight, just overweight. This is a dachshund that weighs 60 pounds. And yeah, almost unheard of. The dog couldn't hardly walk and had ruptured the ligament in the knee, and the other knee was also bad. So what do we do with those now? Because we know that fat is pro-inflammatory. It really injures a lot of musculoskeletal tissue. It's hard on the heart. And of course we know it's pro-inflammatory with all those fat cells that are carrying on the inflammation. It's like having, I'm a firefighter. So if I look at a little tiny fire, it's a little tiny thing on fire, great. That's not too bad. We hose, that's it. But you get these kind, would get inflammation in them, and it's like a big, huge forest fire. So it's really important to get them on the weight reduction programs. We use a lot of beans along with their food just to kind of decrease it, of course. And then we always have them on 9-5 water, and they continue with that as well. So it's a process that we all have to work on. So again, to convince your vets, go to pubmed.gov. Look at the subject heading. Electrolyzed reduced water, that's what you're going to type in the subject heading. Electrolyzed oxidized water, that's again the killing water, the one for the killing of all the bacteria. Print these articles up, make copies, and then give the copies to the docs, give the copies to their technicians, email them and say, how well did you do? Find out how well they did. Discuss those briefly. And again, give them the copies that you may have used a yellow highlighter, that you've done that. And then, again, use the brochures that we have made to help us all the way around, as you know, all that DVD and the brochures that you use. So look at some of the scientific articles yourself and understand them. They're not that difficult, as you will. Here's the journal Biomed Center, and of course it was published, Neuroprotective Effects of Electrolyzed Reduced Water, and its model for water containing, again, molecular hydrogen, and it has the platinum that's monoparticled platinum. That's why it's really stabilizing those electrons. So this was published out of a university called, again, Kyushu University out of Fukuoka, Japan. And the experiment involved neurotesting, of course, these mice under oxidative stress. And they found that it was a scavenger. It's an intracellular scavenger of reactive oxygen species. It did that. It was a neuroprotective effect. Profound, and out of a scientific journal. Then it's okay to give them a background. Doc, are you familiar with what's been going on in the area of injury with these reactive oxygen species? You can talk to them about it. Well, here's what it says. And just yellow highlight it again, just to make sure. So the brain represents only 2% of the tissue, but 20% of the blood oxygen goes there, consumes that. And 25% of all the glucose is produced there. For that reason, the brain is considered the most vulnerable part of the body against reactive oxygen species, and by a byproduct of aerobic metabolism. So we get oxidative stress that's related to the series of brain dysfunction disorders. And in people, and I just parentheses that, in people, Alzheimer's, Parkinson's, the electrolyte reduced water is a function of, again, drinking containing the molecular hydrogen, small amount of platinum nanoparticles, known to scavenge. Give them those articles, because we know that then the oxygen damage is going to be a lot less. And we see so many dogs that have seizures now. We see animals that, again, they're what are showing our environment. And so do what we can to be able to get them through their seizures by, again, giving them electrolyzed reduced water. So in summary, we have a tool, you have a tool. It's probably one of the most profound tools, I think, that the whole earth, the whole world has. And you are all pioneers in being able to present this to your friends, to anyone who has a pet. I mean, even including the pet turtle, okay? They love them. It's a little pet squirrel, anything that is they're loving, and by them showing them the love by giving them the water, and then they see the difference. They see the difference in what that little animal is showing them. My granddaughter has a small, little, tiny rat. It's been her life, if you will, for a while, and that rat's certainly not going to live all those many years, but she is learning to be, quote, the vet in the family as I leave, okay? And she's going to continue with what she knows about little electrolyzed reduced water for her little tiny rat that's now growing and by the way, I don't think I've seen a rat grow and continue to kind of grow, but actually running around that wheel and running around all over the place like it's still just a very young rat, and now it's 2.5 years old. It's amazing. So we see many pet diseases are associated with dehydration. We see that it's a very effective hydrator with 99% of all our molecular structure in our body containing or associated with water. It's just the way it is. And because of the unique hexagonal, if you will, nanostructuring that we see, nanoclustering, the most like a hydrogel water in the cell, we know that it's so important for us to know what? To get them on the water. Because it is a free electron donor as well, it consumes a reactive oxygen species, essentially. And it's because the pets have a faster metabolism and a shorter life, and they are a sentinel for us all. When we then show the difference with electrolyzed reduced water, with the Kangen water, we see that they... Can you see this dog? I took a picture of him, and I know he just had the water. I want some more. And we have a smart little kitty here that's even looking at this is Maggie again, when she was younger. And then look at that, Kangen water. She's looking right straight at it, and she wants it. And this is Bama. The dog's name is Bama. And this dog was paralyzed. She had a disc that was ruptured. She came in wobbly and then went fully paralyzed, all 4 legs. We got Bama on the water. We got the whole family on the water. The family has issues as well, as all do. And as a family, they got better. And then I'm pleased to say that Bama's running around again. She's running around. That's good. So if I had time, I'd say for questions, we'll have those later. There's my email address. If anybody would like to, they can have that. That's tcrowdvm@gmail.com. And my cell number is 706-296-7020. I don't mind sharing things with you all. And as you know, sometimes I spend some time on the phone. Sometimes I can't get to you right away. I'm stuck in an operating room or even fighting a situation like a fire. So yes, we are, all of us are like firefighters. We are carrying children out of a fire. What's going on here is that we're carrying our family, our pets, out of a situation of smoke, of toxicity, of reactive oxygen species, and that water's going to do it for us. Thank you so much. I really had a chance talking with you.
All right, all right. Wow.